Srija is going to lead the presentations. I've reviewed the decks that have been prepared for this session, and we are going to receive a tremendous amount of information in the form of 10-minute updates from each department. In order to ensure that we hear from all the areas on the agenda, we are going to hold public comment and council questions until after all of the presentations are completed. With that, Srija, the floor is yours.
Good evening, Chairman Esser and council members. Very much appreciate the opportunity to be with you. And I am Deputy Chief of County Health and joined by several colleagues this evening with a series of updates that we hope align well with the areas of interest that you identified for us. And I will start us off and then let my colleagues join me and introduce themselves as we go through what we've prepared for you. I want to just confirm that my sound and my video seem okay. I'm just having a little bit of challenge.
They look fine, Srija.
Okay, thank you so much. So as a department, County Health's mission is to help everybody in San Mateo County live longer and better lives. And this mission has a tagline that we adopted actually a few years before the pandemic that has never seemed more relevant, which is altogether better. As our resilience as a community has been tested and continues to be so, we're just very humbled by this mantle of what does it take for everyone, meaning everyone who lives here, everyone who works here, everyone who studies here, to get to that goal of a long, high quality life in our community. Our work is organized in two broad buckets through which we propel this mission. And on the left is our depictions of our public health protection responsibilities. There are many things we do that are about the health and safety of all 775,000 residents in our community. And that could be inspecting a restaurant to assure food safety and make sure that foodborne illness is not transmitted. It could be making sure an ambulance gets there should anyone need 911. And it certainly incorporates a wide range of responsibilities in our pandemic response, which we will touch on this evening, as well as the special interventions that are aimed at intervening early to prevent health problems in the future. Another huge part of what we do is serving as a robust safety net. And this is a safety net for some of our most vulnerable residents, residents with public insurance, residents who have complex challenges navigating medical care, behavioral health supports, other social supports that people need to stay healthy. And collectively, these services, which my colleagues will go into some depth on several of them, touch almost 100,000 residents in San Mateo County. And we recognize the special responsibility we have as a safety net provider to address challenges in people's lives. Not advancing my slide. Are you seeing the next one?
Yes, we are.
Okay, sorry about this. And I want to make sure to give you gratitude as council members, as leaders in the North Fair Oaks community for how you've embraced this mantle with us of furthering health for all. The last many months have certainly required leaders in every sector to become public health leaders. There's absolutely no way that the work that's been required to protect us against the virus that still is circulating could have occurred without so much partnership and understanding and trust building and information sharing. So really, really grateful for what you bring to your roles in doing this work. And you know well that the pandemic also has exposed these very long-standing inequities that continue to challenge some communities more than others. Communities that have conditions in which living is more crowded, work cannot be done remotely or virtually, it's on the front lines, in which exposure is a daily experience. And it's been very humbling and made us double down in our resolve around equity and addressing these longstanding inequities and how we can continue to learn and get better to mitigate what that's going to be for the next generation. I did want to set the landscape of what we see in the pandemic currently. These are data from our dashboard updates as of yesterday. That's 1 week more recent than what's in your packet. And over the past month, we have seen over 7,500 COVID cases, knowing that this is an underrepresentation because these are the cases reported to public health and don't include a lot of home testing that's occurring now. So this is a period of increased vigilance that we're asking of everyone as we see a lot of circulation, and we see positivity rates over 6%.
Oh boy.
And we also see hospitalizations rising modestly, but they're up. And we would expect that to continue to go up as we see the cases circulating. So we do call on you as a trusted emissary of information for North Fair Oaks residents, and we're relaying to every community that we are communicating with that the layers of protection that we've all learned over these many months can make a difference. It's so important to stay up to date on vaccination, getting vaccinated and boosted as eligible. It's also really important to improve ventilation, that as people gather, opening windows or a door as much as possible, having air circulate to thwart the virus's transmission can make a difference. We strongly recommend wearing a well-fitting mask in indoor settings to reduce the risk of infecting others. And this is a time that if you have symptoms, to get tested. There are treatments available, and those are much more plentiful than they were in the early months when new technologies came online. And it's important to be in touch with your healthcare provider if you do test positive, because these treatments work best to start really early. So we encourage anybody who has symptoms to get tested and be in touch with your healthcare provider if you were to test positive, and also additional precautions if you're someone for whom COVID could impose severe risk, and also important to be in touch with your healthcare provider. I wanted to share just a bit of localized data that I believe you have seen before, but looking at the last, our data as of May for North Fair Oaks in particular, it has been such a collective lift to achieve vaccination rates that have been climbing steadily. We still have work to do, but if you look on the right-hand side, you'll see that for North Fair Oaks, 93% of residents have received at least one dose of a COVID vaccine, and 85% have completed the vaccine series, and 44% have been boosted. These rates used to have pretty significant gaps from the countywide average, and they have been climbing and making progress throughout the last many months through so many partnerships, through a range of efforts to bring vaccine to where people are. On the left-hand side, looking specifically by age, you'll see the reach has been especially high in the older adult population, which is where the risks are the most significant. And so really applaud everybody who has taken the action to be vaccinated and to be boosted. And there's still more to be done. We have lower reach in the younger population, especially the 5 to 9 population, and right next to that, the 10 to 17 population. But tremendous progress in reducing gaps. And we look forward to continuing to work together on closing those gaps even more. I wanted to respect Chairman Esser that each segment we keep to a modest duration, and I wasn't sure if you wanted to have questions in between the topics and specifically around the pandemic, if we should pause or.
I think we'll hold questions till the end. I want to make sure we get through all of the data, Srija, because what I'm seeing so far is just super enlightening, and I'd like to do that. And I'd like to ask the council members in particular and the public to note their questions, and we'll have a Q&A session at the end of all the presentations.
Okay.
Thank you, though.
So the second topic as in your agenda is around health coverage. And I appreciate my colleague Claudia Flores, who's also with me, will be joining in sharing some information about health coverage. And as a team, our aim is to maximize health coverage across the community, striving to connect with residents with all available health coverage. You likely know that most residents in North Fair Oaks and across the county receive health insurance through an employer. You know, big insurance companies such as Kaiser, Blue Shield, and others are the backbone of health insurance. And that doesn't mean that that reaches everyone, but the landscape for health insurance has a lot of levers at the federal and state levels to address gaps and affordability challenges. The main public insurance program that residents rely on is Medi-Cal in San Mateo County. That's administered by the Health Plan of San Mateo. And it has been inspiring to see improvements and expansions in Medi-Cal to reach more and more residents, especially during these times when we see how important access to basic health care through one's health insurance can be. Children and young adults qualify for Medi-Cal regardless of documentation status. And just a couple of weeks ago, Medi-Cal expanded to include older adults, age 50 and older, regardless of documentation status. On July 1st, Medi-Cal will also expand in terms of the asset limit so that residents who have an asset, that threshold is increased to $130,000 for Medi-Cal eligibility. And that will actually be completely eliminated by January of 2024. Right now, there is a state measure that's part of the state's budget to extend coverage to all adults aged 26 through 50, regardless of documentation status, effective January of 2024. So that's a lot of information, and I just want to summarize that the public insurance Medi-Cal program, you know, has been a really important resource, and it is expanding. There are folks who don't qualify for Medi-Cal because their income is too high. And through the Affordable Care Act, residents can purchase coverage through Covered California, the state exchange. Residents who aren't eligible for Covered California or Medi-Cal qualify for a local program, the county's ACE program, which is available to residents whose incomes are at or below 200% of the federal poverty level. And Claudia and our team in the health coverage unit help residents access these coverage options in different ways, by phone and virtually, as well as in person with one location being at the 2500 Middlefield location, Human Services Agency building. And then also, of course, online through the Covered California website and My Benefits CalWin. And I'll invite Claudia to make sure she's visible to you. And she had a couple of more detailed slides that display for an individual resident, how does the income assessment look and how can residents get help?
Thank you, Sricha. Can anyone hear me?
Yes.
Thank you.
Yes, we can.
Thank you. Okay, thank you so much. My name is Claudia Flores. I'm from Health Coverage Unit. I've been working, I'm very familiar with the North Fair Oaks. Been working for probably it's going to be 20 years. So, and especially at the North Fair Oaks. So I'm very familiar with residents, the community. And as Tricia mentioned, the residents who are uninsured can get applications through, we are partnering with Human Services Agency. We're outstationed at 2500 Middlefield Road. But since the beginning of the public health emergency, so we've been conducting assistance over the phone. So right now we're helping clients over the phone, and I have more information about our new site that we opened in May. So if you go to the next slide, Sricha, please. Thank you. So this is the federal poverty level threshold for 2022. It looks complex, but don't worry about it. We're here to help. This goes in San Mateo County for 0 to 600% of the federal poverty level. And that includes the county programs and the state programs, Medical and Cover California. So it's broken down by yearly and monthly that you can see. And it is complex. So we always tell our clients, so we can help you. So because every program has their own rules, so we can help to determine the eligibility and assist based on income, family size, and the age of, if it's for children, age of children. Yeah, but it is a little bit complex, but don't worry about this. The next slide is our flyer for the health coverage unit. It has eligibility information, where to apply for coverage, and it also has information in for the income limits. And also, we, as I mentioned before, we open at the beginning of May in San Mateo Medical Center, Monday through Friday, to assist clients in person. Also, drop-ins are welcome, but we encourage clients to call. That way they don't have to go twice in case they're missing any verification. So we need to also screen for COVID. We need to make sure that clients are clear for COVID at no symptoms, and also screen at the front entrance at the hospital. And it's only one person that we allowed in the office, unless there's like an elder person or like child care issues. So we're there Monday through Friday from 8:30 to 5. So our main number is in the flyer, and also the clients send us an email. We can also assist by email. We also are open, I believe, since March or April at the Coastside Clinic every Monday from 8:30 to 5. And the flyer, we have all the information listed, what documents the residents need to provide. But if you have any questions, feel free to give us a call. We're here to help. And I think that's about it. I don't know if I'm missing anything, Sricha.
I think you covered the highlights, Claudia. Thank you.
Thank you.
So the third topic that we wanted to share with you is from Chris King, who is one of the leaders in our Street Field Medicine mobile health team. And I saw Chris in the panelist row.
Hi there. Can people hear me?
Yes, we
Yes.
can, Chris.
And can you see my screen?
We can indeed.
Perfect. Okay. Well, good evening, everybody. My name is Christopher King. I'm a nurse practitioner with Health, and I'm here today to tell you about our street and field medicine programs. So what is street medicine? It is the practice of providing medical care to unsheltered people experiencing homelessness in locations like encampments, under bridges, in parks, at soup kitchens, and in motor vehicles. If you are living outside and you want help, we come to you wherever you are. And so why do we need it? For the complex reason that accessing care in traditional medical settings, that is brick and mortar clinics, is challenging for people experiencing homelessness. First, there is real fear about theft or destruction of unattended personal property. Next, there is trauma from prior negative treatment in traditional settings. And finally, when your main priority every day is finding food, water, a place to go to the bathroom, and maintaining your shelter and safety, it is really hard to find the time, energy, and organizational skills required to focus on or care about your health. Now, sorry for the quick transitions. I'm going to pivot to field medicine. I want to start with a quote that I hope you'll think about the next time you're in the produce aisle at Whole Foods, Trader Joe's, or Safeway. I'll let you take a moment to read it, and I want you to think about these questions. Do you ever wonder where your food came from? Who prepared the soil? Who sowed the seeds? Who watered them? Who tended them? And who finally harvested the crops? So what is field medicine? All you need to do is change the word field to farm worker. Field medicine is taking comprehensive medical care directly to farm worker populations where they live, eat, and work. And why do we need field medicine? Well, because farm workers have so many unfair barriers to getting care. These include eligibility for Medi-Cal and the county ACE fee waiver program, cost prohibitive employer-sponsored plans, transportation, poor cell phone service, working long hours, and traditional health beliefs that don't line up with Western medicine. Next slide is our equipment. These have evolved over time, and we now enjoy a customized van that houses our diagnostics, wound care supplies, and an impressive and extensive formulary of medications. Next slide, our services, physical examinations, labs, COVID testing, sexually transmitted infection testing, vaccinations, wound care, a portable nebulizer, ear lavage, which means washing out the ears, the wax out of the ears, psychiatry on Tuesdays, harm reduction supplies, including Narcan, and the provision of bagged lunches and cold weather supplies. This is our street medicine schedule. 3 teams cover the entire county 3 days per week. And by the way, we love coming to Redwood City and providing services to people experiencing homelessness. But you'll notice if you look at this schedule, we touch Redwood City on Tuesdays and Thursdays, in addition to providing services to many other cities in the county on those same days. Based on the number of people we have been serving and our understanding of the need here, I believe that Redwood City deserves its own full day of street medicine. We would love to give you this if we could find a way to expand the street medicine program from 3 full days to 5 full days. Now that's beyond the scope of my own powers, but probably not beyond the powers of some of the people in this meeting. This is our field medicine schedule. It happens every Monday through Thursday on the South Coast. Next slide. We work closely with many community partners in the county, in particular, Life Moves and Puente de la Sur. Now I'd like to transition to the actual work and let one of our patients tell you about his experience in his own words. I think on the PowerPoint that you'll be able to reference from tonight, there are 4 videos of our patients. They all have important stories to tell, but we don't have time to show them all. So please take a look if you are interested. The remaining videos are of another homeless man and 2 Spanish-speaking farm workers, a male and a female with subtitles. This is Gary's story, and this is street medicine.
Yeah, hi, my name is Gary Inglesby, and I'd like to talk about my experience with street medicine and how they helped me. I'm an alcoholic, and they first started to help me, as I was drinking and helped me quit drinking. And they were there for me when I was drinking and trying to help me, and they gave me some medication to help me. They also I also had a problem with my elbow where I'd fallen and it got infected. And I thought it was going to heal on its own, but I didn't know it was, I was sick as I was. And it turned into where it was septic in my blood. And Dr. Chris advised me to go to emergency right away, which I did. And it's a good thing I did because they had me on antibiotics for 3 days. And I left the hospital. He came and saw me and gave me some more antibiotics. And he saved my life because I was not going to go unless a doctor looked at it and said, you need to go. And I went, and I'm very appreciative for them. They've been very helpful with treating me and taking care of me. And Chris, I appreciate Chris and his team immensely.
So Gary pretty much told you the story, but I want to fill in a few details. The elbow infection that Gary talked about is what we call a septic bursitis. Had he not asked me to look at his elbow at the end of that visit, he might have confused his presenting symptoms of fever and chills with alcohol withdrawal. He probably would have drank more vodka in an attempt to stop the shaking and chills, and it's difficult to determine if he would have presented to the emergency department. He could have died in that van. He eventually left the hospital AMA, but I quickly found him because we know where our people are. And we started him on oral antibiotics and his elbow got better. On March 31st, the day we shot that video, Gary reported 8 days sober. In the intervening time between now and then, Gary had a telephone visit with Dr. Chopra, our psychiatrist, and was started on medications for depression and sleep. And he regularly meets with Frank Vargas, our substance use counselor. He's also working on cutting back smoking, and he is completely engaged with his healthcare in such a beautiful way. I actually saw Gary this morning and started him on a statin to prevent atherosclerotic heart disease. And he proudly shared that he has 56 days sober from alcohol. This case highlights many aspects of our program: medical management of disease, alcohol and substance use treatment, mental health treatment, vaccinations, and much, much more. This is full-on primary and psychiatric care, all directly from the street. And although we don't have time for a farm worker video, I do want to say that we continue to uncover case after case after case of uncontrolled high blood pressure and diabetes on the coast. We are always connecting with farm workers who have not had any consistent medical care, sometimes for years, sometimes for the duration of their lives. We see them, engage them, build trust, and they let us take care of them.
Yeah, hi.
The next slide is basically how we do what we do. These are our strategies in words: repeated engagement, building trust, front-loading care, community partners, different boundaries, intensive care coordination, and caring about them until they can care about themselves. Happy to elaborate on any of these themes in the Q&A if anyone has any questions. This is our team. We're almost done, and I'd like to finish the presentation by sharing with you some of the photos of our team doing the work. The first series of photos are from our COVID-19 vaccination clinics that we stood up last year for both our homeless and farm worker populations. Today, we bring the vaccine with us during street medicine, and we provide it on demand. From right to left, that's Mayela Perez, Frank Vargas, and Isa Segundo. Those three are the backbone of our programs. Next is Isa and me working with one of our farm workers. That's Dr. Trin, our fantastic medical director, examining a farm worker. This photo on the left side of your screen was taken at a Redwood City encampment at Woodside and Veterans. We are working with a gentleman who suffers from painful chronic swelling and ulcers of the legs and feet. That's Dr. Chopra working with a Spanish-speaking gentleman on his chronic alcohol use. That's Isa again, and Matthew Sachs, our wonderful nurse practitioner who leads our Monday Street Medicine team. That's me examining a farm worker in 2019, and that's Marissa Foll on the right, one of our awesome nurse practitioners. and she's examining one of our first farm workers diagnosed with COVID-19. And lastly, while we enjoy and celebrate many successful treatment outcomes, we have lost many of our people since we've been doing this work. The average age of death for women who are homeless is 48, and the average age of death for men who are homeless is 51. We finished the presentation with a photo of a piece of cardboard inscribed with the words, "Rest in peace, Irma, placed under a freeway in her encampment by her people." She was a longtime street medicine patient with a long mental health and substance use history. She sadly died of complications of her chronic medical problems earlier this year. We will miss you, Irma. I got much more, but that's all I have time for. I am super passionate about this work. I much appreciate you letting me tell you about street and field medicine this evening, and happy to take any questions when that time comes. Thank you.
Chris, thank you. Thank you for the passion and heart and information you brought. I believe that Scott Gilman and Carlos Morales are going to be the next two speakers. Scott to share some information about mental health first aid, and Carlos to share information about the ways we work with our inmate residents.
Sure. So I can kick us off. I'll talk for about 5 minutes, and then Carlos will take over. As Sharija said, my name is Scott Gilman, and I am the Director of Behavioral Health and Recovery Services. We are the safety net program for San Mateo County. Most of the services we provide are to people who have serious mental illness, serious substance abuse issues. Not hearing me?
We hear you, Scott.
We
Okay.
can hear you, Scott. Yes.
Yeah, the services that we provide are to the most severe. Tonight, I'm going to talk about one teeny tiny little program that really affects all of you, all of your families, your neighbors, grandparents, and your friends. What we've seen over the last couple of years through the pandemic has been nothing, really nothing like my profession has ever had to deal with. We started learning about trauma and how trauma affects people really around the time that we all had to deal with 9/11. Most of us remember where we were on September 11th. There was a lot of trauma in our world, but we came together. We had a common enemy. We supported each other, but we really learned that the first responders and those that were involved in it suffered from trauma. As we've gone forward and learned more about how trauma impacts the general population, we've seen things like the number of police officers that have now died by suicide that were involved in the Capitol riots. We now know that more veterans have died by suicide than did in actual combat. And so what we're dealing with as a society is essentially a 2-year combat that we've all been through every day without a common enemy, trying to survive this war by staying alive, fighting for toilet paper, and just getting through. It's caused us to be angry, to be stressed out, but not necessarily the sorts of things that would cause somebody to end up in my system. Severe schizophrenia typically doesn't occur because you're stressed out or because you've gone through trauma. What we're dealing with now is a pandemic surge of behavioral health. We desperately need the general public to understand how to do some basic triage and basic first aid for people who are having mental health problems. You don't have to be a surgeon to do first aid, and you don't have to be a psychiatrist to do mental health first aid. It's an 8-hour program. We are putting on all over the community for the next 2 years with the call to action that absolutely 100% of people in San Mateo should be trained in mental health first aid. It'll teach you skills that you need to intervene, to say hello, to say the word suicide. A lot of people are afraid to say the word suicide. I'm telling you right now, as your mental health guy, you can say suicide if somebody is feeling weird or you think there's something different. Mental health first aid training will teach you how to intervene. It'll teach you how to address the stigma. It'll make you feel safe running up and saying, Annie, are you okay? We all know what to do when we see somebody laying on the ground. We run up. We might have learned that in high school. Annie, are you okay? But when you see somebody sort of a little acting off in the community. We're afraid, we don't know what to say, and this program will teach you that, teach you how to intervene. So call to action. There's flyers that I've provided and that we'll send out to you all. The mayors in the cities have come together. Every city in San Mateo County would be promoting mental health first aid classes. So there's lots of options for you to take advantage of this. And again, please, we need you helping to triage the people that need services, like maybe a talk to a friend, maybe they go and have a walk with somebody. They don't necessarily need our services. They need a primary care doctor for sure, but it doesn't rise to the attention of us. So mental health first aid for everybody in San Mateo County. And thank you for your time. So Carlos is going to talk about jail, mental health and jail services. No speaker, or we can't hear you, Carlos.
Your microphone isn't unmuted yet for some reason.
Here we go.
We can hear you now.
You just muted yourself again.
Hello?
Yeah. There we
Okay,
go.
great. I'm
There we
sorry.
That's okay.
Hello, my name is Carlos Morales. I'm the Director for Correctional Health Services, and I just want to thank everybody for expressing some interest in corrections. And Correctional Health Services provides medical, dental service, mental health, and substance abuse in 2 jails in Redwood City. And we provide medical and dental services at the Youth Service Center. And I'm going to briefly go over some of the highlights of some of our programming. And then I'll end with how the pandemic has affected us. So I just want to start with our acute stabilization unit, which is comparable to psychiatric PES, psych emergency services at the medical center. And it's a 10-bed facility. It's a 10-bed inpatient psychiatric unit within our McGuire Correctional Facility. And it provides both voluntary and involuntary treatment for options for inmates who are acutely disabled by their mental illness, or who may also have co-occurring substance abuse disorders. We brought this online in October of 2018. It's with Correctional Health Services through an RFP process, and we brought in a contracting agency called Liberty Healthcare Corporation. And this is a clinical collaboration between Liberty, Correctional Health, and with the Sheriff's Office. I want to talk a little bit about a behavioral health program that we brought online in September of 2017. The Board of Supervisors approved some funding for our mental health programming at the McGuire facility. And the participants in this program must have a mental health diagnosis and are experiencing psychiatric episodes while in custody. And the program provides contingency management and behavioral treatment plans and assistance with reentry. I want to briefly talk about Choices, a program, which is a modified therapeutic community modeled after Delancey Street that serves men and women in separate pods at Maple Street Correctional Center. The goal of Choices is to reduce recidivism by providing services which address the common problems for incarcerated individuals: substance abuse, poverty, low self-esteem, and poor health. Then participants learn how to manage their addiction and live a drug-free life. This program has been going on for 25 years. And then we recently brought on what we call a cross-functional team. And the old cliche of the best discharge planning happens on intake. That's essentially what we've done. We've combined several of our teams to kind of eliminate the siloism that we experience in the facility. And we put a team together at intake and in booking that does both the people coming in and being released. So they're managing both parts of that. And it's a multidisciplinary team of 2 nurses, 2 medical office assistants, 2 forensic mental health clinicians, and access to psychiatry and medical services. And let me see here. The last program I want to talk about briefly is the Medicated Assisted Treatment Program, which had started in August of 2017. And we were serving mostly alcoholics at that point, and we were offering Vivitrol. Since that time, we've expanded quite a bit. We have collaborations with IMAT and several other community providers. We're also in a learning collaborative with 33 other jails and learning how to best provide these services. And just to give you an idea of the volume, it's increased, and fentanyl is a big problem, and opiates in general. In April of 2022, we had 264 inmates out of 950 inmates that we intaked during that month that reported illicit drug use. 146 inmates out of 915 had the COWS opiate assessment, which COWS stands for Clinical Opiate Withdrawal Scale, and it's a protocol. And those folks that go through that protocol are offered Suboxone and to manage their cravings. And upon release, we provide them with referrals to other providers in the community that provide medicated assisted treatment. We also provide them with Narcan when they leave to assist with a potential overdose. And the MAC continues to provide substance abuse and Vivitrol to inmates with alcohol use, and we're expanding. I just want to briefly touch on how the pandemic has affected us. You know, I'm knocking on wood, we have not had anyone go to the hospital for COVID, but since the pandemic started, we were able to use our tuberculosis protocol to, we took that and we just kind of enhanced it. And everybody that comes into booking gets a rapid test, and then a third day in, they get a PCR test, and then they are put in quarantine for 10 days unless they become positive, and then we are able to isolate folks. And one of the positive things about having 2 jails, we have a modern jail that opened in 2016, but it's mainly open space, and it's pods, and it's very hard to, and they're in dorm situation. Whereas in McGuire Street, it's an older facility. It's from 1993, and it's single cell. So we were able to quarantine folks pretty well and identify people who had cleared and could go back to general population. When Omicron hit, it was very challenging for us because it was spreading like wildfire. But again, I just need to acknowledge the staff who really hung in there and continue to hang in there. And we are masking up every day. We follow those protocols. We do universal testing, and we offer vaccines. And so far, we've vaccinated 1,054 inmates. At least got 1 vaccine. 925 have gotten 2 vaccines, and then we've got 327 boosters that we gave. Now, you've got to understand that the average length of stay in custody is 14 days. So we have a lot of churn, and 18% of our population is staying over a year. So I'll just end with, I'm really proud of how we managed the pandemic up to this point, and really hats off to our nursing staff and all our clinical staff. Everybody pitched in, and thank you.
Thank you, Carlos. Thank you, Scott. appreciate both of you sharing the call to action that Scott relayed that affects everyone in this community, and hoping for the council's involvement. And Carlos, it's nice to be able to share the important work that you do for our folks who are in custody and how well we've been able to protect together. So thank you. Our next up is the trio from the San Mateo Medical Center team, Jack Nasser, Raul Ramirez, and Dr. Hashush, sharing information about our dental offerings.
Yes, hello everyone, and my pleasure being here. So I have Raul Ramirez also with me, who's the dental program coordinator. We'll be sharing the slides.
Hello, everyone.
So I am the supervising dentist for the dental department at San Mateo Medical Center. And today I'm going to be speaking to you about the work we do in the dental department, specifically at the Ferox Dental Clinic. We can move on to the next one, Raul, please. So it's why dental care is important. In the mouth, there's a mixture of bacteria. We have the good bacteria and bad bacteria. And then when the bad bacteria load gets much greater than the good bacteria, it tipped off the oral health balance. And then we end up having gum infection, tooth decay, tooth loss, bone loss, and tooth mobility, in addition to its negative impact on systemic diseases. According to the CDC, 47% of Americans at the age of 30 have gum disease. So the mouth is the gateway to a healthy body. As you can see, gum disease affects many organs. Gum disease leads to oral manifestation of HIV, which is first seen in the mouth. Bacteria can travel from the mouth through the bloodstream to the heart, causing heart problems like strokes and heart attacks, or travel to the lungs and cause emphysema or pneumonia. There's a very interesting bidirectional relationship between gum disease and diabetes. So patients with gum disease, they have the diabetes is bad, and then when gum disease improve, diabetes improve as well. Rheumatoid arthritis also has bidirectional relationship with gum disease. Arthritis is affected by the body inflammatory responses to dental infection. Bacteria from the mouth could also cross the placenta of a pregnant woman and lead to pregnancy complications like a preterm birth, miscarriage, low birth weight. And interesting enough, researchers are finding oral bacteria in the brains of Alzheimer's patients. Next, Rahul. Thank you. So the Ferox Dental Clinic is located in Redwood City. Our office hours is from Monday to Friday, 8:15 to 4:15. And we do open the fourth Saturday of the month from 8:15 to 4:15 as well. We do have a daily drop-in emergency hours from 8 to 9. No appointments is needed. And it's the largest clinic. It has 8 chairs. Next, please. Daily, we have 3 general dentists, 5 dental assistants, and 1 dentist student from UCSF Dental School. Additionally, on Tuesdays and Thursdays, we do have 4 dentist students from the University of Pacific. 2 days a month, we do have 2 oral surgeons. Tuesdays and Thursday, we do have 2 dental assistant students from the College of San Mateo. On Friday, we have 2 hygiene students from Foothill College. 4th Saturday of the month, we do have extra help dentist and assistant providing dental care to Cordilleras patients. And these are long-term patients from behavioral health. Ferox also has changes this year. We are providing dental services to Cordilleras patients. Starting coming August, we are going to have an additional UCSF dental student joining our rotations. Starting in June, we will have a 3rd oral surgeon, and then we'll have a 3 days of oral surgery at Ferox. Who do we serve? We do serve lots of patients and variety of patients from all ages. We do serve adults and children, providing comprehensive dental treatment. We do serve walk-in patients with dental emergencies, Ryan White patients, patients needing dental clearances for a variety of medical needs, which could be for heart surgery or hip replacement, or for starting a medication or treatment like radiation or chemotherapy. We see pregnant patients during their pregnancy and now after delivery for a year per the Dentical guidelines, which expanded their coverages from 60 days to a year. We also serve the Cordilleras patients, the long-term patients from the mental health facility. We do provide variety of procedures, starting from emergency dental services to exams, to root canal. We do provide nitrous for anxious kids, to crowns, bridges, and removable. Next. Yeah, I think I went over that. Thank you. So safety is our #1 priority. We actually take pride of that because, you know, as dental professionals, we are at increased risk of COVID-19 because of our routine exposures to patients' airways and performance of aerolized generating procedures. However, it is important really to note that throughout the pandemic, no known exposure between our staff or our patients have been reported. We follow strict infection control recommendations and OSHA guidelines. You know, every patient basically is screened, temperature checked, asked to hand sanitize. We provide the mouth rinse, antibacterial mouth rinse prior to procedure, prior to exam, in addition to implementing various layers of protective measures for staff and patient safety. As you can see, we do have like HEPA filter in every room. We have plexus barriers in between staff, desk stations. We do have polyethylene curtains, which is very thick curtain in between also patient's room. And we do have, this is pictured in there, it's the extraoral suction that really help with absorbing, you know, the generating aerosol procedure. Our patient visits. So this is, this graph actually is showing our volume trend just for Ferox from June 2018 to March 22. It's really worth noting that during COVID-19, we didn't close our clinics at all. We stayed open and we took care of emergency patients. We slowly increased our number, which is evident from April. We have been really trying to recover and attempting to bounce back to our pre-pandemic numbers, despite the challenges we're facing throughout. This is just showing our drop-in visit in the fiscal year of 21-22. We've seen so far 694 walk-in patients. And it shows the increase in our care. We do see patients with variety of insurances, not private insurance, but we definitely see our greatest number of patients are the medical. We take care of pregnancy patients, emergency. We see ACE patients for drop-in visits. We take care of their urgent need. And then if they continue care with us, they become a discounted health patients. We encourage them to go and enroll in CHA, which is Community Health Advocate, to get discount up to 65% discount. I just wanted to note that we also take care of homeless patients, not necessarily at Ferox, but if we do have, you know, from any area, residing in any area, that we can see them at the van, which is located now in the parking lot of the hospital. Next. We partner with many clinics, many organizations and schools to be most representative of and impactful in the community. So we do see farm workers, patients, you know, we we partner with Ravenswood, Sunrises. I want to really point out HPSM, which is effective beginning of January of this year. HPSM has integrated dental benefits into HPSM managed care plan. And so our patients that are HPSM members are receiving medical dental benefits through that plan, which is really translate to more dental services to these patients, more access. It also opened the opportunity for specialty services by coordinating referrals between our clinic and specialty offices for services that it's not available in our clinic. Next, so our challenges. We've been having lots of challenges, since the pandemic, really. We do have staffing shortage. More patients are seeking dental services at SMMC due to limited numbers of medical dentists in the community. Appointments needed greater than availability. Increased number of pregnant patient referrals, dental coverage for OB, which is a pregnant woman, is extended to 12 months after delivery versus the 60 days originally. SMMC patients have greater treatment needs than private practice patients. And Fair Oaks Evening Clinic has been closed since the pandemic. And that's it. Thank you for this opportunity and for your interest.
Thank you, Dr. Hashush. Thank you.
I just
Jack
like
and Roll.
I'd just like to add just a few words to our dental presentation. So as all of you know, as Dr. Hashush mentioned, dentistry plays a vital role in the overall health. And at San Mateo Medical, we treat all aspects of patient health. And we're happy that our dental clinics are embedded in with our primary care, our pediatric, our specialty clinics. So it's really a one-stop shop for our patients. And as Dr. Hashush mentioned, we also have the ability to go out into the community with our mobile dental van to do events out where patients have access issues. But I've come to have such a tremendous respect for dentistry after being involved with systems that have had these embedded services. And we are so honored to be serving with all the other county services that provide to the community. And so thank you for giving us the time to share today about our dental services.
Appreciate it. So I think we have two additional speakers representing the two ends of the age spectrum that County Health reaches. And I think the baton goes next to Nina Reed, Deputy Director for Aging and Adult Services.
You appear to be on mute, Nina.
Am I not on mute anymore?
We can hear you now.
Oh, thank heavens it worked. So thank you so much, Srija. I have to say it's my first time using Zoom in a presentation. Usually I use Teams every day. And so I apologize for the delay. Thank you for allowing Aging and Adult Services to be part of this presentation evening. It's a pleasure to join you today. And so I have the very broad category of talking about services, public guardian, and all of the resources. And so I will possibly be skipping a few slides, but I'll get going. So I hoped that in this presentation, I could provide you a few facts about our aging community, because I realize that health is broad and there's just not as many opportunities as we would like to highlight our aging population and the growth in this population. And so I did want to show you this slide. Do you see my picture here? Should I move this over? Is it blocking the slide?
No, we see you well. I mean, we see the slide well.
Okay. So on this graph, you'll see that San Mateo County is the blue bar. So there's the blue bar, and you'll see that there's this height difference around 35 to 44. And then just this big population of aging people. So we are blue and the rest of California is orange. And you'll see that we expect that this older adult population will continue to grow, and the demographics of this population are just continuously growing. So 10 to 20 years, services for our older adults will just continue to be on the rise. And so that's just a quick depiction of San Mateo County versus the rest of the state. So in San Mateo County, it's important to note that many of our older adults see their income reduced by half as they age into their 80s. So given our high cost of living, this poses a significant challenge to our older adults who are often house rich but income poor. So I want to spotlight on the zip code 94025. I took this zip code, it's a little bit broader, I understand, than the 3 census tract areas for the North Fair Oaks area, but I thought it was important to just take a little snapshot. So taking a look at one of our biggest services, our programs, IHSS, we do serve in this area 159 adults, it's the yellow, who are 65 plus. And so I wanted to highlight it's 259 individuals who we serve total in this zip code, and we do serve children. So that little blue slice right there, those are children. So I wanted to just point out a little bit about the ethnicity groups that we serve here. The largest number, 81, did identify as white, but very close second is Hispanic. And then behind that is Black, with a sprinkling of all other races, ethnicities that we serve in your area. And here we have a question that we do ask, what is your preferred language? And so English is preferred by 149 of the 259. And then close, and then second would be Spanish. And then we go Russian and Mandarin. So I wanted to go into now our overview of services from Aging Adult Services. And I wanted to really highlight our information and referral line. So this is known as our AS hotline. The 1-800 number is a number that we would encourage anyone to call. It is staffed by social workers Monday through Friday from 8 to 5. And what we do is we do an assessment to see, do you know what you really need? What kind of help are you really looking for? It's also the line that you would call, anyone would call, if they have any type of suspected abuse, because our adult protective services, this is where you would call and say, something doesn't seem right. I think I need to report. I have some suspected, abuse concerns here. And then you would call that 1-800 number. So our APS does investigate reports of abuse for older independent adults. I wanted to highlight some of the common, I call them myths about our APS program. So we have a team of social workers, and these social workers are not going to force clients out of their homes. They're not going to enter a home without permission. And it's very, very important to just point out that APS does not force people to accept their help and service. It's a voluntary program. So under the umbrella of APS, we have our, what we call EDAP team. So it's Elder and Dependent Adult Protection Team. And what they do is work very closely in a multidisciplinary team with our district attorney's office to really investigate and prosecute older and dependent financial abuse. So it's important to really look at that. We noticed there was just this huge, huge need to support our community in cases of suspected financial abuse. So I know that this presentation was supposed to really highlight our public guardian services and our conservatorship services, but what I really wanted to highlight was the fact that we have mainly 2 types of conservatorship. One is known as probate conservatorship, and it's for individuals who start really losing their capacity to make decisions. Oftentimes, it's due to dementia, developmental disabilities, or traumatic brain injury. And then I'm going to skip this next slide. The other type of conservatorship is LPS, and this is for individuals who have serious mental health illnesses who need special care. So also within our protective services, we do have the public administrator program. And we investigate estates and administer the estates for the people who die without a will or a person who is willing to act as the administrator. So now I'm going to move on to our supportive services within Aging and Adult Services. The first program I'd like to highlight is Linkages. This is a program where we have case management and we provide a lot of service to support somebody, someone who is frail, at risk, somebody who has some level of impairment and who does not have Medi-Cal. That is one of the key differences of this service. In-home supportive services, I provided those slides earlier for a snapshot of who we serve in your area. This program serves 6,400 individuals across the county. So this is our largest program. You have to have Medi-Cal. You also have to live in San Mateo County, but this is a statewide program, and you have to have a disability that lasts longer than 12 months, which is certified by a healthcare professional. And so basically a social worker will go into your home and take a look and examine, assess your cognition, your functional limitations, challenges that you have getting around your home, bathing, dressing, cooking, cleaning, all of those things. It's a comprehensive assessment that is completed. And then you are authorized hours for a caregiver to come into your home and help you with that care so that you can remain safely in that home. So our public authority is the entity that really maintains a registry of caregivers and handles all functions for payroll and training for those caregivers. So in this program, we call it a program, but it's really a service. It also has about 6,500 individuals who care for our IHSS consumers. So this is a new program that we have. It's our AAS Enhanced Case Management Service. It's a pilot with the Health Plan of San Mateo. And we're really trying to look at how do we keep these very complex, medically complex adults, older adults, home, in their home, in a community setting, so that they don't have to go to a nursing home. And so we're hoping that this is successful because we all know that older adults, anyone would prefer to stay at home rather than going to a different type of institution if possible. So I wanted to just, highlight some of the community-based services that are out there. It's very, very important. We work with our community so closely. We couldn't do it without them in maintaining care for our older adults and people with disabilities. So we hold contracts with many, many CBOs, community-based organizations, who provide our legal services, nutrition services, health insurance counseling and advocacy through HICAP, adult daycare, and again, dementia care. We also support our Commission on Aging, Commission on Disabilities, and the Public Authority Advisory Committee, who advocates to the Board of Supervisors and AAS about the needs of our older adults and people with disabilities. So just wanted to thank you for your partnership as we continue to provide service and care for older adults and people with disabilities. If you have any questions, please call our 1-800 number. There's always somebody who will be available to either take that message if it's not 100% urgent, or take that call immediately. So thank you. Here's our web address. And we have just moved, just so you know, you are the first ones that I am just sharing this information with. We are now at the Alameda Building in San Mateo.
Thank you, Nina. Such an array that you covered with graciousness.
I know.
Highlighting our growing older adult population. So our last speaker is Dr. Chabra, who is going to take the other end of the age continuum.
Thank you very much. And I'm trying to find my presentation, which disappeared. Here we go. All right. Are you seeing that? Yes, okay.
Yes, we are.
Yes.
Thank you. There we go. All right. Well, thank you very much for having me here today. And what I want to focus on is within Family Health Services, our journey towards evidence-based home visiting programs. Family Health Services provides a number of different services, including the WIC program and other nutrition services, including the program for CCS or California Children's Services. But this focus will be on home visiting, and I'm Anand Chabra, the medical director of the division. I do want to acknowledge some of my colleagues. First, the knowledge workers in home visiting who carry out the work day to day, and their supervisors. And then the managers and coordinators who helped me put this presentation together, Christine, Guillermo, Maribeth, and Amy. And we're funded by the county through Measure A, by federal Title V funds, by federal matching funds, and by state general funds. So we have a real array of resources coming into home visiting services. So where do we stand now in terms of evidence-based home visiting? Family Health Services has 2 full-service evidence-based home visiting programs. Nurse Family Partnership, which we started in 2012, so it's been around for 45 years, very well-respected national program, but locally for almost 10 years. And then Healthy Families San Mateo, which is based on the Healthy Families America evidence-based program that's been around for 30 years and also heavily researched. And we started our local program in 2019. We also have the Black Infant Health Program, which is evidence-informed and uses an evidence-based curriculum called Triple P, parenting curriculum. Our pediatric home visiting team also uses the Triple P curriculum and an evidence-based asthma curriculum. And the nurses in children and family services use the Safe Care curriculum. So I make a distinction between evidence-based curricula and a full-fledged evidence-based program where the whole program has been researched for many years. And the full service evidence-based programs we have are Nurse Family Partnership and Healthy Families San Mateo. And so 27 out of our 51 knowledge worker home visitor positions are in a full service evidence-based model. And that's definitely the direction we're going in family health. So now I'll talk a little bit about each of those 2 programs. So for Nurse Family Partnership, the founder, David Oles, said there's a magic window during pregnancy where the desire to be a good mother can help you overcome incredible obstacles. And that's what we see locally as well. And I'm not going to read through everything in these slides. Of course, you can read them at your leisure, but I'll just cover the high points. Nurse Family Partnership is an evidence-based community health program, and it focuses on improving pregnancy outcomes, on improving child health and development, and also on improving families' economic self-sufficiency. The criteria for NFP, including being a first-time mother-to-be, enrollment prior to the 3rd trimester of pregnancy, so that's before 28 weeks gestation, being a county resident, and being low income. And the length of service of the program is from pregnancy through the child turning 2 years of age. So a minimum, if you finish the whole program, it's a minimum of 27 months, and it can be longer depending when you enroll in the program. While the focus is definitely initially on the mother or the pregnant person, and then later on the identified infant, certainly partners and extended family who are involved in supporting the mom and supporting the infant and child are very much included in the program. So since we started this in 2012 locally, we've served 819 women in San Mateo County. And if you look at the age breakdown, you'll see that more than half are teens. So we have had teens as young as 11 years old at the time of pregnancy and enrollment into the program. So about 20 were 11 to 14 years of age when they enrolled. And then 50% of the group were somewhere in their teenage years, with the other 50% being a little older than that. 82% of our clients identify as Hispanic or Latina. And about 6 out of 10 referrals came from a healthcare provider or from a clinic. Now, NFP is famous for its outcomes. So here are some local outcomes. 96% of the toddlers were up to date on the immunizations. 98% of the mothers breastfed following the birth, and 57% was still doing it at 6 months. The vast majority of infants and toddlers were assessed with the Ages and Stages developmental tool. And when we look at birth outcomes, we had an 8.2% preterm birth rate. So that's birth at less than 37 weeks gestation. And that compares favorably to the California rate. It's a little higher than the San Mateo overall rate. Even better, the low birth weight rate among the NFP participants was 6.5%, and significantly better than California and the San Mateo County rate of 6.9%. And as you probably know, children who are born low birth weight, which means under 5.5 pounds, are at risk for developmental issues, as well as physical health problems and long-term health problems. We were able to pull an estimate of data of North Fair Oaks clients, and we had 119 served since the program started about 10 years ago. Similar to the general population, 59% were teens, the other 41% a little bit older than that. 3/4 identified as Hispanic or Latina, and 21% declined to answer, so it might actually be a little higher than that. And about 3/4 of referrals came from healthcare providers. I won't read the story, but you can read it at your leisure, but we were able to include this nice story in the Children, Youth, and Families budget for the county. And now I'll briefly talk about the Healthy Families San Mateo program, which is based on the Healthy Families America model. This was one client from the national level. I didn't know how to raise a kid. I needed help. I didn't know where to go. I'm an only child myself, so raising a boy, I had no clue. But Healthy Families America changed my life to the nth degree. So Healthy Families San Mateo, it's a leading family support, evidence-based home visiting program with the belief that early nurturing relationships are the foundation for healthy development, and it promotes healthy child development and growth and enhanced family function by also reducing risk and building protective factors. The eligibility criteria for this program are all pregnant people, so it doesn't have to be your first pregnancy. Enrollment prior to giving birth, so anytime during pregnancy, being a San Mateo County resident and Medi-Cal eligible, and the length of service is from pregnancy until the child turns 3 years of age, though most clients stay in the program about a year. In terms of number served, since we started in 2019, we've had 576 women served. Excuse me. You see the age range is a little older than NFP because if they're first-time parents, we try to have them go into NFP if they're willing. And then 79% of clients Hispanic or Latina, and 3/4 of referrals coming from healthcare providers. When we look specifically at North Fair Oaks, we have 85 women served with a similar age breakdown that you saw from the general county. And again, about 70% of referrals coming from healthcare providers. We don't have the same level of outcome data for Healthy Families America or Healthy Families San Mateo. And that's one of our big projects this year, is really cleaning up and making sure we have the good outcome data for the program. But we were able to include a success story there too in the budget for the county, and you can read that at your leisure. And with that, I'll pass it back to Srija.
Thank you, Dr. Chabra. And I think the floor, I will turn back to Chairman Esser. We almost kept within our time as we tried to provide a lot of information across the range of population services settings in which we're aiming to further health. So how would you like to handle questions?
You all did terrifically, by the way. covering a wide range of topics efficiently and communicating an awful lot of information. What I'd like to do now is open it up for public comment. If we have any members of the public that would like to comment on the presentations that they've seen this evening. Deanna, do we have any public comment?
During this time, members of the public, if you wish to comment on agenda item number 3, San Mateo County Health Updates, please raise your hand now. Not see any hands raised at this time. Back to you, Chair.
Okay, in that case, I would like to go ahead and invite members of the council to ask questions. Go ahead and raise your hand, and I will call on you. Let's see, I see a hand raised. Councilmember Rodriguez. Everardo, go ahead.
Yes, thank you. Thank you all for your great presentation. Lots of very useful information, and it's great to know that that we have such a team of dedicated people to serve our community and other communities throughout the county of San Mateo. So I appreciate your time this evening. I actually have several questions, so I don't want to hog all the time. So I'll just ask a few, and if other council members raise their hands, feel free to pass the mic on to them. But I have several questions. I'll go in the order that people presented, a question for maybe Sreja, and perhaps also Dr. Chabra, and that is, I saw the rates of vaccination in North Fair Oaks, up to 90 something, and that's very encouraging. However, I also looked at the overall percentage of Latinos throughout the county, and it remains relatively slow when compared to other groups at around, I think I saw 30, let's say 35 or 38. But anyway, still low compared with that. I'm wondering if there are still any current efforts to reach out to those groups that are still low in vaccination, because I know Latinos was not the only group. I saw a few others.
Yeah, I appreciate the question, and of course invite Dr. Chabra to chime in, given all his leadership in his roles through our vaccination effort. So as of this morning, we do definitely see gaps in reach in the Hispanic population, the Black population, and the Pacific Islander population. The Latinx reach just hit 80% for a first dose, and I believe it's 72% for 2 doses in the primary series. So that is not as high as we would like to be, but it has been steadily climbing through a couple of key strategies of trustful outreach, information sharing, and making every effort for people to hear information that they can find credible from the right sources in the right ways, in language, in culturally appropriate ways, and then making vaccination accessible through steady availability. Those community offerings at the Fair Oaks Health Center site twice a week continue to have around 70, 80, 90 each week. So it's chipping away. It has kind of been the strategy to remove barriers. We also have been receiving advice from various community partners, specifically for the 5 to 11 or the pediatric population, that it might be worth trying some different school-based or after-school program-based locations, as that group has had, it's been a slower take-up as parents have made the right decision for them. And we did also invest in heavily Spanish advertising campaign through radio, TV, local TV, pairing with personalities that might have visibility and recognition, and had some relatively high reach numbers. So we're not giving up yet. We do have lower reach in those populations, but those are key strategies that remain important to us as we continue to try to remove barriers and increase trustful reach. Dr. Chhabra, do you want to say anything else?
I think you covered it. I think it's been challenging, especially when rates were low. People were not feeling the need maybe to get vaccinated at that point or boosted. But I think what we've generally seen is whenever there's a swell or a surge, demand tends to increase with that. And then of course, there was the news today of the CDC approving the booster dose for the 5 to 11-year-olds. And so that may generate additional interest in that population, even for those who haven't received their primary series yet. That's all I can think to add right now.
Jack, did you have some insight?
Yeah, and also to add, not so much in our dental clinics, but in our primary specialty OBGYN, whenever we have any patient that comes in for any services, in the screening process, when we have them come in, we always ask them about their vaccination status, and we always offer to provide them vaccination education and vaccination access at that moment on site, so they don't even have to really even wait for a vaccination clinic. So I think to what everyone's saying is it's multiple points of contact. And today, for example, we were chatting with our staff, and they were asking us, do we need to ask our patients every time they come into the clinic? And the answer is yes. And the reason why is because they might have had a family member that has gone through a significant COVID experience, or they lost someone, a loved one. So they might not have maybe the the instinct to go and to a vaccine clinic, but if they're coming in for a checkup or an appointment and they have the opportunity at that point of contact, we've seen a lot of people that said no in the past that are saying yes now. So we are trying in every realm point of contact with our patients in our community to reach out to them, to give them that access to those vaccines when they want them in an easy fashion and accessible fashion.
Excellent. I have a couple of questions also for Claudia Flores related to ACE. And first one is in terms of accessibility. Is the help provided to apply for ACE available in languages other than English?
Absolutely, Ever. Yes. So we're assisting clients in multiple languages. So we have right now the flyer English, Spanish, Tagalog, and sorry, let me get back. So English, Spanish, Mandarin, and what other, I forgot what other language, Tongan. So we are also, we'll use the language assistance. So we assist clients in multiple languages, and our our mission is to always even for the increase of Portuguese speaking population has been increasing. So sometimes we feel comfortable talking to us in Spanish, and I think we should don't assume or don't we can misinterpret the information, or we're going to help them. And we offer the language assistance in different languages. So did I answer your question? Or?
I had some data on the 94025 zip code for ACE and Medi-Cal as well. I glossed over it as I was going through our presentation, but our most recent data, 979 ACE participants from the 94025 zip code, and 4,690 Medi-Cal recipients. So we do hold ourselves accountable to the reach, based on what we think is the population who's eligible, and whether it's language barrier, cultural barrier, availability barrier, we try to overcome those. Raul.
Yes, Surya, I also want to add that, now, as Claudia mentioned earlier about the in-person visits and screenings for patients needing access to insurance, especially working with the mobile dental clinic and homeless population and patients that may not have insurance, we're actually having, as when we have direct patient care with them, that we also, when they're identified to not have insurance or that they might be eligible for certain other types of insurance, that we refer them directly. We have a couple of pathways to provide this service, whether it is by creating an appointment for the patient at a time that is convenient for them, or if they're at the medical center, that they can just basically drop in and be seen by one of the CHAS or community health advocates right then. And so that way they can learn, what type of documentation and other information they need to provide in order for them to become eligible.
Absolutely, Raul. You can refer clients to us directly. You can provide them with the number, and you know that we're open beginning in May, Monday through Friday at the CHA office, West Entrance. You can refer your clients there.
We already have sent a few.
Perfect. Thank you.
Thank you. My next question is, I wonder, Claudia, if there is one of your staff members embedded at the North Fair Oaks Health Center, and if not, would it be possible to have a person available there, which is usually the place where people may find out their eligibility has either expired or changed, or also where they may be compelled to sign up for the program.
I'll just start, and Claudia can certainly chime in, but unfortunately, the North Fair Oaks Health Center needs every inch of space it has for the important medical professionals that provide services there. So we are typically located at the 2500 Middlefield location, the Human Services Agency building, just to divvy, using our medical grade space for the medical professionals and having the supportive services available very close by. The Human Services Agency is determining, its timeline for reopening that location. We do have a staff member that works out of that location. We really appreciate being in that community and available to that community. But we need to just make sure that our Human Services Agency colleagues have a plan for when that's going to work for their entire operations, because we're just one part of their operation.
I understand. Yeah. Thank you. Through the chair, if no other council members have questions, I still have a few.
Please go ahead, Pepper. And other council members, if you do have a question, please indicate by raising your hand, and we'll work through everyone.
Thank you. One of my questions was for Christopher King, related to the street medicine units. First, I wanted to clarify that these are not the mobile clinics, the large vans that I've seen here in North Fair Oaks. Please, if you can clarify,
Sure.
how many units, and are those the same team, different, that kind of thing?
So those folks are my colleagues. The mobile clinic, the big RV, the big recreational vehicle that you see parked at 5th and Spring Street on Wednesday afternoons from 12 to 6 at the old Arteaga grocery store. That is our mobile clinic. And it is staffed by a nurse practitioner, a nurse, a medical assistant, and a PSA and a driver. And they're a fully functioning medical clinic. They see folks, kids for immunizations. They see homeless people. They see uninsured people. They see folks with Medi-Cal who are trying to get into the primary care clinics, but their appointments haven't come yet. And so that's who you see on Wednesdays. And they're also located at Fair Oaks Community Center on Tuesdays from about 9 a.m. to 1 p.m., doing the same thing, offering the same kinds of services. They're completely different from what we do. We're in a little passenger van. We're a team of 2 to 3 people that generally go out Mondays, Tuesdays, and Thursdays, and we provide street medicine to people experiencing homelessness all over the county. So we go to people where they are. And in particular, we come to your area, to the North Fair Oaks region, to Redwood City on Tuesdays and Thursdays. And, and I did advocate or, make a pitch for trying to get us more time because, for example, today I started my day this morning doing street medicine at 9:30 at St. Bruno's Catholic Church in San Bruno. And I had 9 people to see before I even left the parking lot of the church. And then I'm partially responsible for the Redwood City area. And I went down there and I was able to get into one encampment, but that's not enough. You guys have more need than we have the manpower to support. I could be out doing street medicine all day long, 5 days a week. And we would do a pretty good job if we could do that. But we love the work, and but yeah, I probably answered more of a question than you wanted me to. But that's who we are. So we're mobile. We're going from spot to spot, place to place, location to location, taking care of people who are living on the streets.
Excellent. And so, would your schedule allow for additional visits, or what kind of support would you need from the council and from the county?
Well, maybe I'll let Sreeja help me with that one, but I mean, we need 2 more days to cover the county adequately. We need a team in Redwood City that drives from San Mateo County up here, drives down to Redwood City in the morning at 9 o'clock and stays in Redwood City and doesn't leave. Right now, the 2 teams that serve Redwood City, we are also serving San Bruno and South San Francisco on Thursdays, and on Tuesdays we're serving San Mateo and Redwood City. So it's too much. There's more homeless people than we have the manpower to support. I mean, if we had the funding for 2 more days, hiring a little bit more staff, probably getting another passenger van, we could do it on a very nimble budget. I think we could,
And just to be transparent, and so appreciate Chris's passion, we wish we could do more. We are constrained by budgetary resources and personnel resources, and how much of the demand are we able to meet? And we try to make the best decisions, with leaders like Chris, of like, given what we have, where can we make the most difference? Where can we make that most impact? But we know there are people we're not getting to. We know that it's not possible to clone the team we have without the resources. And that's a process through our county budget. There's some reimbursement that supports the work of the street and field medicine team, via billing, like Medi-Cal, for example, but it's almost all funded with county general fund resources that support the really, really vitally important work that Chris and his colleagues do.
Thank you. One final question for Chris is, if your services, the street medicine, as well as the mobile clinic, do you know if you are connected with the emergency services, emergency service providers, like, fire department, sheriff, should there be, I don't know, the big earthquake, are you connected with those departments?
Yes, we're not really, we don't have any official people that we're connected with the fire departments, but I have contacts. My team has contacts with police departments in each of the areas that we serve, and we reach out to them, routinely, or they reach out to, they more often reach out to us than we reach out to them. we'll ask about, the difficult clients. We'll ask us, hey, could you go see this person? This person doesn't look well. And so we partner in that sort of way. And of course, there's times when we need to call 911 for patients who are out of the scope of what we can do for them in the moment on the street. Their medical condition has deteriorated so rapidly and so badly that we have to call 911. Of course, the paramedics come and we partner with them on handing the patient off to them to get them to emergency medical services.
Great, thank you.
Thanks for the questions.
Do we have any other questions from council members? Okay, I actually have one for Chris. Obviously, Chris, it's the goal of the county this year to move to functional zero with regard to homelessness. And what I was wondering was, will your team pick up responsibility for the navigation center and the other facilities that the county is buying to aid in that transition to functional zero?
Yeah, I think I'm going to let Surija answer that question for me.
Okay.
I think it would be wise to do that.
Okay.
So right now, Chairman Esser, we are exploring what would be the on-site role for medical support, for behavioral health support, other services that could be provided on site. It would require choices about how the capacity of Chris and colleagues' team gets directed. And some of that, the team does go to Maple Street, or was going to Maple Street regularly. That's 1 day a week, right, Chris?
Yes, and they're back in Maple Street now. They're back
Okay.
in Maple Street on Monday afternoon.
Mondays.
Yeah, the mobile clinic.
And given that there will be a larger population there, what are the options for that larger population and that will have complex needs to receive the medical and behavioral health support that's necessary? And we're trying to explore what resources are available, what capacity is possible. But the dedicated capacity we have now is what we devote to Maple Street, which is not enough to serve, the larger population that we expect to have at the navigation center.
Okay, no, that makes sense. I see Juan Carlos with his hand up. Go ahead, Councilman Prado, the floor is yours.
Thank you. Good evening. I don't know who specifically this question is for. My concern is what communication or teamwork is there with other health providers in the county that are not directly connected with San Mateo County, as we here in North Fair Oaks border with other cities and other communities. Specifically what I have in mind is Ravenswood Family Health Center. I know that they are also serving a very much underserved community, as are we and you here in the county here in North Fair Oaks. So I wanted to see what partnership or how you guys work together as we kind of are in the same region of the county.
Yeah, appreciate the question, and I can start and invite my colleagues to join. Ravenswood Family Health Center is an absolutely critical partner to us, and there is a lot of coordination and collaboration that we engage in with other entities. Our scope and our geography and our focus varies. So with Ravenswood, certainly for the East Palo Alto and neighboring community, they're the primary care and dental provider, and then they provide some other services that have a broader geographic boundary. Some residents in North Fair Oaks may choose Ravenswood as their primary care provider, and others choose the Fair Oaks Health Center as their primary care provider, and others choose another safety net provider. That coordination occurs in a couple different ways. The Health Plan of San Mateo, as the insurance network, tries to assure assignment of patients that reflects their choice and their best fit for them, as well as if there are gaps, who is available to serve those primary care needs. And then providers refer to each other to supplement the other additional needs, whether it's specialty services. I know our dental programs coordinate, as Dr. Hashush was mentioning on the slide, certainly in behavioral health, certainly in once it gets to hospital levels of care, service might follow a hospitalization, services might precede a hospitalization. So there is a pretty established set of referral partnerships so that every patient can get what they need. It's hampered by technology limitations and different, systems and the like, and we're striving to overcome many of those. So it's not perfect, but it's definitely, with core institutions that have served the community for such a long time, there's quite a lot of collaboration and coordination that occurs. I don't know if any of you others want to jump in on this. Dr. Chabra?
Yeah, I'll just say that in terms of family health services, WIC has an East Palo Alto site that coordinates very closely with Ravenswood Family Health Center. We support them in implementation of the Comprehensive Perinatal Services Program for pregnant women. So they're one of the partners that we work with specifically around the OBGYN services. And then, we receive referrals from them for most of our home visiting programs and child health programs. So yeah, there's definitely a close connection there.
Thank you so much.
Do you have any further questions, Juan Carlos?
No, thank you.
I have a quick one that I wanted to make sure we got in before we left tonight. I see your hand up, Everardo. Let me get one in real quick. And this is directed to Scott Gilman. He discussed the mental health first aid program. Scott, if there's a way you could share a URL or a link or something like that that could direct us to that, I think that's something that that the council members would definitely like to see. And so if there's an easy way to do that, if you could put it in, can we put it in chat, something like that? That would be.
Actually, Diana has a flyer. I sent it to you just a little bit ago, Diana. And there's a URL in there. May is Mental Health Month. So along with the first aid classes, there's other suicide awareness and other mental health events that are happening all month long.
I really was not aware that there was such a thing as an 8-hour mental health first aid program. It's something I personally would be very interested in, and I suspect other council members would be as well. So we'll coordinate with Deanna to get that information out to everyone.
Thank you.
Thank you. You have a question, Councilmember Rodriguez. Go ahead, Everett.
Yeah, thank you. This was related to the presentation by Miriam Hashush. Apologies if I'm not pronouncing your last name properly, but my question was in regards to the oral surgeon, which you mentioned it's available 2 days per month. And I'd like to ask, what is the alternative for a patient that needs urgent work, but falls outside of those 2 days per month?
So Dr. Hashush had to jump off the call. She was still in the dental clinic, and she's operating on patients tomorrow. I wanted her to get rested up. I have Raul on the call.
Yes.
Raul can answer that question.
Yeah, thank you, Jack. Yes, thank you for that question, Councilman Rodriguez. So there are different options. So Fair Oaks Health Center is one of our facilities across the county. We also provide oral surgery services in other locations as well. So if a patient, needs access to emergency care that is in a neurosurgery appointment is needed, we can coordinate with our other clinics to provide that service sooner if needed. Also, as Dr. Hashush mentioned, we do have our drop-in clinics, our drop-in times for emergency patients. So if the patient were to have a change in their dental condition from the last time that they were seen, they're more than welcome to come in and be seen and assessed and provided with medication and other services in the meantime. And then if the oral surgery appointment is needed much sooner, then the clinic coordinates with other sites to provide that service when needed.
And just to add to that, we also, given that these services might be in other locations, we do offer transportation for those that transportation is an obstacle or a hardship for. So we will be able to help them get from where they are to where these services are at as well. So we always do screen with our patients to see if transportation is a barrier for them, and if so, we will help to provide those services for them to connect them with also their medical and transportation needs.
And
Thank
also to add to that, Jack, I think also Health Plan of San Mateo provides similar services as well for patients that go through Health Plan Medicale specifically.
And while we have our dental team, Jack or Raul, I was pleased to hear that that on Tuesdays and Thursdays we have 4 dental students down from UOP working in the clinic. I did my undergraduate work at UOP out in Stockton, and had a lot of friends that went on to San Francisco, became dentists out of there. So we've got good people helping folks
Yes.
from the clinic. Question on that is, what sort of outreach do we do to the unhoused population with regard to dental services and preventative care?
So we do have different options. We are in partner with Healthcare for the Homeless and Farm Worker Program. And we see patients at multiple locations, but we do have a dedicated clinic. We have our mobile dental clinic, which provides services to to the homeless, which at this point, due to a staffing issue with our driver, we are not able to move. But we are seeing patients. So we work with the multiple different homeless shelter locations, as well as drug rehab programs, where they refer us their clients to to us, and we schedule those services. And again, some of the wraparound services that we provide access to could be if the patient does not have insurance, or we can connect them with the community health advocates to obtain insurance. Same thing, some of the services that we might not be able to provide directly in the mobile dental clinic, like oral surgery, they're also coordinated to other sites as well. And with that, also the farm workers, we're providing Saturday clinic at the coast for patients that live in the Pescadero and coastside areas who are not able to come in for appointments during the week because of the work schedules, etc. So we're trying to provide as much access as possible for them, not only for the homeless, but also for the farm workers as well.
I understand. That's terrific. I see Councilmember Rodriguez with his hand up. Ever, do you have an additional question?
Yeah, I only have 2 last questions. One is still related to dentistry, and that's there was mention of the dental clinic opening again for the evening hours. When may that happen?
So as Dr. Shush had mentioned, one of our biggest challenges, and it's not just for dentistry, but across the healthcare spectrum, is staffing right now. We are in the process heavily to engage and identify more staff, but just as we are, all other health systems are doing the same thing. So we're all competing for the same pool of applicants that are out there. And the thing with a county system, we really need to attract those that are mission driven. We're not going to pay the highest salaries, but we are going to be able to give someone an opportunity to have a career which is meaningful, to serve their community. And at the same time, as a civil servant, that's the only area I enjoy working. I've worked in the private sector, but to answer your question more directly, it's something that's ongoing. We are having interviews for various classifications, from RDAs to dentists to administrative staff, ongoing in real time. And so we are doing our best to attract and to hire and to also retain the staff that we have, so that we can continue to maintain services and output. So it's something that's ongoing and in real time. And we are trying to find creative ways to identify those that would be mission driven and be attracted to our system to come and join our system.
Thank you. My final question is to Nina Rhee regarding the aging and adult services. Does the in-home services, are those the same as what we call house visits, different? And does the county have house visits anymore for the homebound elder or patients that need that?
So in-home supportive services, we have our social workers going out to people's homes to assess. So I don't know exactly what you are indicating for home. Because I'm not familiar with the term, but we don't send nurses out necessarily. It's really social workers doing assessments to see how people are functioning at home and watching safety. So we do cognition, assess for, any memory impairments, how people can move around in their homes, what they need to be safe in their homes. And then we're authorizing for someone to come in to provide help.
And in-home supportive services itself are providing support for those activities of daily living, whether it's bathing or food prep or those types of activities. That's what IHSS supports.
Great. Thank you for the clarification.
With that, we are at the top of the hour, and I would like to thank all of our presenters this evening. A fabulous amount of material. I'm sure I'm not the first person to commend you for all of the work that you and your teams have done, especially over the last couple of years. It's just been, of course, incredibly challenging, and the work that County Health has done has just been absolutely amazing. I'd like to thank Peter, who coordinated the presentations we heard this evening, and Shrija, who moderated and kept us on schedule and did a super job there. Thanks also to the members of the public who attended this evening, and as always, to our county staff, Deanna, Tim, and Kenny, for their support. Next meeting of the North Fair Oaks Community Council will be a regular meeting next Thursday, May 26th. And with that, I will entertain a motion to adjourn.
I'll move to adjourn the meeting.
Do we have? Okay, all those in favor?
Yes.
Thank you very much, everyone. Good night, everyone.
Good evening,
everyone.
Thank you. Good night.
Thank you.
Thank you.
Thanks. Good night.